go in here so we can have the recording, and we'll post this on our YouTube channel. But you know, with Micah, first I want to give a little bit of background. Micah, I actually talked with him. It's been, I mean, almost a year ago when we connected, and he was the one that started to first help us to implement ozone therapy within our clinic. And so today we're going to talk about really what is ozone, what are its applications, what does that look like for your health, for your wellness. But he is the founder of Doctor's Ozone, which is, what that is basically it's an educational YouTube channel. And it's just all about education, helping people understand what ozone is, which I'm like, well, that's perfect. We're going to bring you on and we're going to start to implement that and helping people around Kansas City truly understand, or any of you that are, you know, friends with me here on Facebook, truly to understand, you know, what is ozone, how does it work? But his mission is honestly to educate people about effective options, alternative options. We were just talking before we hopped on, and I said, you know, one of the things I've said through my whole career and in over 15 years of educating and teaching on health and wellness is that we think of, you know, alternative medicine as the second route after conventional medicine hasn't worked for us, when in fact, what we really should be doing is maybe looking to some of these alternative options before we start moving into the drugs, into the surgery. And because quite honestly, what it ends up being is then we have to heal twice. You know, we have to heal from that drug, that surgery, and then we have to heal from the underlying condition, or vice versa. So, you know, there's a lot of prevention. There's a lot of regeneration that we're going to be talking about. But first of all, I just wanted to say welcome, Micah. Thank you so much for joining us and taking time out of your very busy schedule. I mean, I've been following you and watching you. To me, you are like the expert to the experts when it comes to ozone and really how that applies to our health and our wellness. I mean, you were with, Mr. Bulletproof here just a few weeks ago, which is super awesome. You're talking about anti-aging and the benefits of how ozone works for there. But I'd love for you just to kind of, you know, give those that are listening just kind of a brief explanation of who you are, what you do, and really kind of what your passion is through ozone therapy and alternative medicine.
Yeah, so like you were saying, really the goal is to educate people about more options. Like we were saying earlier, if people knew, you know, they had to get a knee replacement and they knew there was a $500 option that might help them try and give it a shot before they go for the full-blown knee replacement. So, and yeah, I appreciate you saying expert of the experts. That's so cool to hear. I don't view myself that way. It's more of just investigative journalism. So really what I'm trying to do with ozone therapy is like bring together all the pieces, because there's a ton of research out there. There's a ton of pieces out there, but it's pretty in a difficult to digest format because it's so all over the place from multiple languages. And I'm just really trying to bring that into digestible information for people. And it's been growing in popularity. So it's been really exciting to be here. And you asked for my kind of background and how I got into this too. So essentially, I started going down the conventional route. I wanted to become a doctor eventually. I was going to nursing school. I was working in an ambulance. I was working in a pharmacy too, just kind of doing the whole gambit of things. And I was like, oh, I'm going to be a doctor someday. And at the same time, I started working a little bit with my dad in some of these integrative modalities. So he was selling something called UBI, ultraviolet blood irradiation at the time. So that's a therapy for like autoimmune disorders and infections and things of that nature. And I had a lot of interaction with doctors on the phone. So I really got to pick their brain about medicine. I was pretty excited, you know, going into medicine myself. I wanted to understand it. But I really started to see two different worlds. I started to see kind of what I was being immersed in school and what I was working with on the ambulance. And then kind of what these doctors were saying, which are more, let's get to the root cause and kind of identify what the issue is. And then, you know, like you said, drugs and surgery, let's make those a final option. Let's do the less invasive, the less expensive options first, and then progress into something that's more invasive and more expensive. So I started to see kind of the difference there. And I remember very specifically asking this question, which was, you know, type 2 diabetes. We were giving patients metformin and then we just increased them over the rest of their life. Why don't we give them like a 6-month program and say, hey, here are the lifestyle, or 6-month program with metformin, and say, here are the lifestyle changes you need to make over the next 6 months so that we can reverse the type 2 diabetes. But the mindset in that world is so much, let's just take drugs, let's find cures, those types of things, and not lifestyle change, that they actually said, well, we don't have a pill for that yet. We don't have a pill for type 2 diabetes, which is a lifestyle choice. And I know people get to that point, and they don't intentionally get to that point. But you still do, and there are ways that you can reverse it. So I really started to see the difference in these two worlds, and I was like, well, I'm more interested in the things that are I think really going to help people, which are the lifestyle changes, less expensive options, and the less invasive options. I think would be a great first choice for people. So I started to go down that road and work more with my dad on the ultraviolet blood irradiation machine, which has been used for very serious infections with great efficacy. It's got attention from Harvard Medical by Michael Hamlin, and it really just kind of started to ramp up. So at one point, I had I have a little bit of an entrepreneurial spirit in myself, and I had interest in ozone therapy because a lot of the doctors using the UBI were also using the ozone. So I started to kind of tinker with and make different machines, and eventually made a machine that was a third of the price of what was out there, a lot more stable, and it was relatively easy to use. So that was kind of my entry into ozone in the ozone world. There's a lot from there, but that's really how I got started.
I mean, I was just saying, for those of you that join or coming in, the guy that I'm talking to has actually written this book right here. It's the introduction to ozone. And I was telling him it was kind of crazy because I was reading another book that was this one right here. And I started looking at the names, and it basically was father and son. And, when he talks about, when there's Harvard research that's out there, I mean, I was just reading the book on the ultraviolet light therapy. I mean, it's brought in recognition even to the cancer societies of how it helps with cancer. But what blows my mind is that nobody hears about this stuff. And again, that's the main reason why I'm bringing you on here, is to really open up not just eyes but minds, and helping people to understand that there are alternatives. And again, like whether it's an osteoarthritic joint or an autoimmune condition, it's if there's an option that could actually help to build their bodies up, and that's ultimately why I wanted to bring you on here, because at Regenerative Treatment Centers, it's about how do we build people up on a cellular level? I mean, even all the way down to the mitochondria, to begin to increase that cellular immunity and to build them up. So I guess with that, for those that are listening, like if you were to just kind of briefly say, this is what ozone therapy is, like kind of in the terms, just to get it out there. I mean, how would you explain that specifically?
If I had to do it in 2 words, I would say stimulates homeostasis. And by that means that helps the body with self-regulation to do what it's supposed to do. So you send a drug into the body, usually turn something on or turn something off. It's very, binary in that sense. But ozone therapy is very complex in what it's doing. It's going into the body and it just stimulates it. So it doesn't necessarily turn one thing on or turn one thing off. It has a stimulatory effect. And that encourages the body to do what it's supposed to, which is operate better. So whether you're injecting it into the knee, it's telling that area of the body, hey, you need to heal this up. And, there's a ton of things we could go into from there and how it's actually doing that. But whether you're injecting it into the knee or you're mixing it with blood, putting it back into the body, which is useful for like autoimmune cancer, infectious diseases, things of those nature, and not a cure by any means, but something that is helpful and can help with some of the mechanisms that are going on. So I guess really briefly, that's what ozone therapy is doing.
Creates that homeostasis. Yeah, we were going to actually speak yesterday, and so I went live over lunch, and I was actually doing an ozone treatment, doing autoheme, meaning that we drew my blood, we put the ozone into my blood, I retransfused it back into my body, and I do that every once in a while, honestly, like you said, to create that proper homeostasis, to make sure that my body is functioning at its optimum potential. And one of the benefits that I see from it, specifically for me, is quicker recovery time from like workouts. It helps me actually sleep better, which is great. I mean, I have 4 kids that are running around all the time, so when I can get some good sleep, even if it's only for 4 hours, I need that great sleep. So that's one of the things that I love. But what have you seen, I guess, through your interviews with multiple doctors, I guess through patients? I don't know, are there any stories that stick out, any benefits? I know you say about homeostasis, but what have you seen from, again, whether it's autoimmune, and we're not saying that ozone therapy is something that cures things. We even talk about treatment of this, but it's facilitating a response within the body that has those reactions that really does create some great results. What have you seen over the years? Have you been educating and talking to doctors with this type of therapy?
Well, that is in a sense a little bit difficult to answer because it's so versatile. So it's used commonly in cosmetic medicine, dental medicine, medical medicine, being like the cancer, autoimmune, and Lyme, and the regenerative, the joint injection medicine. When I'm thinking, so I don't have like the hands-on clinical experience that a lot of these doctors do, but kind of living vicariously through their stories, there's a few that stick out, and it's very commonly like, oh, I was bone and bone, or let me grab one in specific. So Dr. Jeff Wright always tells this story about how he had a patient who, I think he was working really heavy construction jobs, but there was some sort of accident where like 500-600 pounds fell into his head that he was trying to support, and caused all these fractures in his spine. And of course, over time that eroded the discs to the point where it was pretty much just vertebrae were just sitting on top of one each other. So you can imagine the amount of pain that kind of person is in. Like, I have a back injury. I have spondylolisthesis grade 2, which is kind of like a permanently slipped disc. And that's relatively painful, but that's nothing like what these guys are experiencing, where they're bone on bone, multiple vertebrae, can barely walk around. So, and this is the typical story. The guy goes through, 10 or 12 clinics trying to figure out what he can do to mediate the pain, because opiates aren't a good option. I mean, you're going to end up with an addiction, and maybe it's just not a great option. So anyway, it goes into Dr. Jeff Wright, and they decide to do the prolozone injections, which is using the ozone gas along with some other nutrients. They can inject it into vertebrae. They can inject it near vertebrae. They can inject it into the joints. And that is that regenerative effect. But with this guy in particular, after I think he said 6 treatments, he was able to walk around to do the things he typically enjoyed doing. Rather than having to take a break every 10 steps, he was able to walk miles at a time, was able to enjoy life. And his was so severe that he did have to continue doing it. That's a very severe case. But there are cases where it's not so severe, where people have complete remediation of the issue. So for joints that are achy, frozen shoulder, for knees that, are starting to give out with age, that not due to, catastrophic accidents, but just starting to kind of give out with a lot of use. Those are the types of things that it has a permanent effect on. So really a lot that works with.
Awesome. Now, I mean, one of the main reasons that I brought this on and within our clinic is, my wife's own story with chronic Lyme disease. Now, I actually just listened. So if anybody, it's Doctors Ozone, right? Is the YouTube channel specifically?
Yeah, it's DRS Ozone. And there's also the website, which is doctorsozone.com. Really, most of my effort goes into the articles on the website and then the videos on the YouTube channel.
I'm getting to basically tell everybody, go there, listen to this stuff, because I can share this stuff as much as I want, but if you want to listen to the expert, it's this guy right over here. And the last doctor they were talking about was one that actually has been treating patients with Lyme disease. If anybody that's watching my own personal story with my wife and Lyme, and we know with Lyme, it's such a complex condition, whether you're dealing with the bacteria or the co-infections, there's so many, it's so multifaceted. That's why it's so hard to treat. But what I love, and maybe you can attest to this, is when you talked about creating homeostasis with ozone therapy through autoheme and things like that. That's really why this type of therapy works so well. But there's some other kind of capacities of ozone that I don't think we've really touched on. But how does it affect things like bacteria and viruses and those types of things?
Yeah, so kind of a prelude of getting into Lyme. With the bacteria and viruses and things of that nature, ozone has a different effect outside of the body than it does inside of the body. So say I had an infection on my skin. If I were to spray ozone onto there, it's going to kill the infection topically. However, if I mix my blood with a little bit of ozone, it's not going to go in and kill the infection. It's a very different response. So there's kind of 2 different ways that it's used in that sense. One is topically. So that's when it's kind of like a disinfectant is the easiest way to think about it. And the other is for a more systemic treatment. So again, it's going into the body, it's stimulating homeostasis. It's not necessarily going in itself and killing the bacteria and virus. And so you might be wondering, well, then why would it help with something with Lyme disease? That's an infectious disease, or these viral infections. It's because it's able to actually stimulate the immune system, and not just up, it's actually immune modulating. So immune modulating, say we have an underperforming immune system, like a lot of people with cancer, they're going through chemo, they're doing a lot of things that is suppressing their immune system. So it's really important that they're regulating their immune system up. So it can help to bring the immune system up in that circumstance. Whereas if it's an autoimmune disorder, which is an overperforming immune system where your immune system begins to attack itself or the body, ozone therapy can actually help to regulate that down. So that's immune modulation. So in the case of like Lyme disease, that's one of the things that it's able to do. It's helping your immune system to kick on. It's helping to stimulate it and saying like, hey, there's a problem here and you should probably address it. So it's stimulatory in that sense and helping the body to act better on the Lyme disease. And not only is it doing that, there's a whole cadence of issues. So immune modulation is one and kind of a big bucket, but I usually say that there's 4 or 5 different things that I hit on with ozone therapy, just to kind of hit the basics, which is immune modulation, which we just said, oxygen efficiency, which is your ability to utilize oxygen, which for anaerobic species like virus and bacteria usually are. It's better if your body is better utilizing oxygen to be able to eliminate them. And that's not the same as just breathing oxygen in. It's more on a cellular level. It's your actual ability to utilize oxygen on the most basic levels in your body. Number 3 would be microcirculation. So a lot of times with diseases, we become inflamed. Nutrients aren't getting to the places that they need to go. So it's important that your veins and those types of things are open and allowing nutrient exchange in those areas. So it stimulates microcirculation, which allows nutrients to get where they need to go. 4 would be oxidative stress. So reduction of oxidative stress. Oxidative stress is causes chronic disease, and chronic disease causes oxidative stress, which is something that we don't necessarily want in our body. So it's able to reduce oxidative stress. Also a really interesting thing, but those would be kind of 4 basic things that it's doing in the body.
Awesome. Sounds like all good things, right? I mean, those are all things.
Yeah.
I mean, we live in honestly a toxic environment. We live in an environment that we're always bombarded, physically by everything around us, from the food, the air, to things we drink. So to be able to obviously reduce, number 1, oxidative stress in of itself is going to help a lot, even just with prevention. Not just that we have to try to combat all of these diseases, but we can actually prevent some of these things from happening, keeping our cellular immune system strong as much as we possibly can. So again, I need to say our immune system because I can barely say it fast enough. It doesn't come out right. But where do you see this therapy, going maybe in 5-10 years? I mean, I know you're on a mission. So you're kind of in the thick of it, talking with doctors all the time, implementing, helping to implement these therapies within clinics. And so where do you see that?
So I think there's 2 places specifically where I see a lot of potential growth for ozone therapy. So one of the issues with it is that there's a huge disadvantage to ozone because people are a little bit misinformed about what it is and those types of things because of pollution. So people will say the ozone layer, they'll know one of 2 things about the ozone layer in the sky or ozone as a pollutant. So it becomes a little bit difficult because you have to educate people beyond that hump of what they've been told for a long time. And it's not as though they're wrong. So ozone as a pollutant is bad. It is the part in the pollution that's purifying it. But when you isolate ozone gas, it's extremely different from that. And ozone, I didn't say earlier, is O3, whereas that oxygen is O2. So it's just 1 extra oxygen atom on top of that. But there's a big hump that you have to get over with educating people about it, and the FDA takes a super strong stance on it too. They don't necessarily like it, but there's a lot of doctors using it in the States. It's growing rapidly, and I think it's going to be accelerating past FDA approval, hopefully within the next few years. And I think the most likely candidate for that is going to be in dentistry, and the reason is because in dentistry, they're using Clorox still for cleaning out infections and things like that. Clorox is bleach. And it's a little counterintuitive to use that in your mouth. And I don't know about you, but I particularly wouldn't want that in my mouth. So I would say that's a pretty low hanging fruit, because we could replace the bleach or the Clorox with the ozone therapy, where you can't breathe it, but you can just put a suction in the back of the throat. And they've done studies. It's not a problem. And that's going to be a good alternative to something like Clorox and bleach for cleaning out infections, because once it's done its job, it's just oxygen. So there's really no toxic effect to it. Other than breathing it, you can't breathe ozone. That's the only thing you really can't do with it. The other place, I would really be interested to see if it's going to take off with the regenerative injections for joints and things of that nature, because there's been some speculation that insurance could potentially pick it up. So if insurance figures out that, oh, we can save a ton of money ourselves by telling people to get this injection before they get the surgery, we'll be good for that. So that would fast track it, get it explosive growth across the country if we got one of those two things. So I think that's where it has the most potential. I think it has the least potential for medical, just because it's so difficult to research, because again, it's stimulating there's a ton of research and there's a lot of good researchers devoted to it, but it's difficult to really get it nailed down, because like I said, the drug is kind of easy to measure. It's turning something on or it's turning something off. This is stimulating the body. That's a huge complex process. So really getting that under wraps is difficult. So I think the medical is growing with the doctors that are using it, but kind of its overall explosive growth, I think, might be a little while.
Yeah. You talk about insurance companies trying to get to that point of, saying that it's going to, because it does do so many things. But we're also to the point of, you said when insurance companies can realize it can actually save them money, and whenever I present and I share on any regenerative therapy, no matter what it is, ultimately what it comes down to, we talk about like price and cost. What does it cost us to not take care of ourselves? What's the price that we pay to do that? And I think that's the same thing even with ozone therapy. Like you said at the very beginning, if somebody could do an injection for $500, and even if they can do it, like you said, like up to 6 times to prevent a total knee replacement, or they can actually walk in and out of a place and actually start to regenerate something, as opposed to go through, pay $60,000 for replacement, and then they're spending 6 to 10 months to maybe feel better. Still there's no guarantee, but they're not whole anymore. They're still dealing with that same issue. So I think there's so much to be able to move forward with in these therapies. So I'm super excited to be able to obviously offer them here. What I'd like to do is have you share how people can get a hold of your information, how they can contact you. I know you already gave your website, your YouTube channel, but I'd love for you to share that again. Information. They can contact you, or not necessarily you directly. I'm not going to share your cell phone number or anything, but just how they can get information more on ozone if they're looking for that.
Yeah, so info@DoctorsOzone is a great place to start. So that's a good email if you want more information, if you want to talk with somebody directly about that. And I do want to reiterate too, what you were saying is just people are canceling their knee replacement surgeries and people are firing their conventional doctors over ozone therapy. So there's definitely something happening here that I think it's not unprecedented. There's a lot of things that people are unfamiliar with that they just don't know about, that are great options, that have good research behind them, and they just aren't aware. Because not all the doctors have a pager that says, "Oh, new therapy out there." Yeah, we gotta, So people are wondering, like, well, if it works, why doesn't my doctor know about it? Because he doesn't know everything there is to know about medicine. So you have to start with the understanding that your doctors just don't know everything. Medical research is this huge category. So this is just one of those things that works. But info@DoctorsOzone is a great way to get a hold of somebody to talk about ozone. Micah@DoctorsOzone is the email that'll go to me. There's the YouTube channel, Doctors Ozone. And this is all DRS Ozone. And then the website, doctorsozone.com, drsozone.com. So those are just ways to get educated about ozone. But really, I think too, going in and experiencing it with people like you, Dr. Bonder, that can give them the sensation of it so they can understand what it is, how it's incorporated into their life, whether they have a disease or, like you said, whether you're healthy. I do it too. I've been doing IVs. I think I'm going to be doing number 5 tomorrow in the last couple of weeks, but super helpful. I do that. And then I go to the gym And I'm like, man, I just destroyed that workout. So it's a great feeling to be able to have that.
And I'd love for you to touch on, and this wasn't, I was, obviously had some specific questions that I was going to go through with you, but since it kind of got brought up, you talk about the big question really is, and I get this when patients come in and, or if I'm hosting a seminar or out in the community, well, I went to my doctor and he said it doesn't work, or, he has no idea what it is. And like you said, doctors really don't, I mean, they know what they do and they get paid for what they do. Not many of them want to venture outside of that pocket. And I'm sure you hear about that all the time. I'd love for you to just kind of to go a little bit further into that, because you were talking about that a little bit. If basically the question is, hey, my doctor said this won't work, or that's basically the main question. How do you typically respond to that?
Well, I don't think it necessarily works for everybody. Not everything works for all people. So I think you have to be okay with that. And that I'm okay with it, certainly, that ozone therapy isn't going to help everybody. And that's just kind of the facts of it. But I think a lot of people can be helped by it. And I think if somebody's making the broad general brushstroke of ozone therapy doesn't do anything, it's only bad, or there's no scientific research on it, is something I hear a lot too. I mean, those just come from a place of not knowing. So I don't think it's too difficult to address. The information is out there. There's a ton of it. And that's kind of what I'm trying to do with Dr. Ozone, and is bring more of that in. It's just that the person doesn't know about it, or they know about it as a pollutant, or they know you can't breathe it, but there's just so much more information out there. So it's really not a difficult thing to address when people kind of have that skepticism that is coming more from a point of ignorance. And something I was talking with Jason West too that I really like that he said is, sometimes when you're approaching a doctor or somebody that it's kind of outside of their scope, don't go from the standpoint of, hey, I know more information than this doctor and he needs to believe that ozone therapy works. No, at the end of the day, it's about getting the patients better. It's about getting people better. And if you interact with them on that common ground, which is, what can we do to get people better? That's going to be a much more effective way to communicate with that doctor, because that's a common ground. You're not coming from a hostile situation or a hostile standpoint. So I think it's important to be like, hey, I've heard of somebody that this worked for them. There seems to be a lot of people. I went to Dr. Rowan's YouTube channel. He had 500 testimonies on there of people getting better with ozone therapy. Do you think this patient might experience a good result based on these couple studies or whatever? And going from the common ground standpoint rather than the hostile one.
Awesome. Well, Micah, thank you so much. Honestly, I'm honored, very grateful that you took time out of your day to share kind of your passion about ozone therapy, and hopefully we can do this again sometime. There's a lot of fun for me. Really love bringing this information out. Again, we're doing this for everybody that's watching. We're doing this to honestly spread the word about different options that are out there for healing and regeneration. So with that said, thank you very much.
Yeah, absolutely. I appreciate it too. It's a huge honor that you had shared me with your group of people. It's kind of, we tend to protect those things. So if I get on that circle, it is an honor just to be a part of that. So yeah, I think this will help a lot of people, and I hope more people become educated about their options. Might not be the one you choose, but it's good to know about it either way.
Right. Knowledge is power. I mean, be able to take the information, utilize it how you feel it's going to be best for you. That's why we do this. And so if anybody wants more information, this is going to be saved. It'll be on our Facebook page. It's also going to be on our YouTube channel at Regenerative Treatment Centers. So go look for it. You guys can watch it. You can share it with anybody that you know. If you have any questions, you can actually just put it in the comments below. I'll get to those questions and answer them the best that I possibly can. And I may reference right over to Micah's YouTube channel, because he's got way more information with many different doctors, which is incredible, sharing their experiences with their patients and what they're doing to help save lives every single day. So thank you all so much. I appreciate it. And we'll talk to you soon. Bye.
Thanks, Adam.
All right.